What does your October retinal thickness map mean? Imagine having a detailed map of the inside of your that shows exactly how thick or thin different parts of your retina are. That's what an October retinal thickness map provides. It's a visual tool used by doctors to understand the health of your retina, especially in the central area called the macula, which is key for sharp, detailed vision. This map is created from special images called optical coherence tomography scans that take cross-sectional pictures of your retina. These images measure the distance between the innermost layer, known as the inner limiting membrane, and the outer boundary, often the retinal pigment epithelium. The device then uses this data to generate a color-coded map. Warmer colors like red and orange show thicker areas, which can sometimes mean swelling or fluid buildup. Cooler colors like blue and green indicate thinner regions, which might suggest tissue loss or atrophy. This color system helps your eye doctor quickly spot areas that are abnormal. The map isn't just a pretty picture. It provides important information about your eye health. For example, if the map shows increased thickness in the macula, it could mean you have macular edema, which is common in diabetic retinopathy or vein blockages. On the other hand, if the map shows thinning, it might suggest cell loss or atrophy, which can happen in advanced glaucoma or age-related macular degeneration. Some advanced October devices can also break down the retina into individual layers, allowing doctors to see if specific layers are affected. For instance, thinning of the ganglion cell layer might point to glaucoma, while fluid accumulation in other layers can be linked to age-related macular degeneration. In addition to the color-coded map, some October systems compare your retinal thickness to a database of normal values. These deviation maps highlight areas where your retina is significantly thicker or thinner than average, helping detect early or subtle changes that might not be obvious just by looking at the images. It's important to remember that these maps are tools to guide diagnosis and monitoring, not standalone tests. They need to be interpreted alongside detailed structural images and your overall examination. Understanding your retinal thickness map can give you a clearer picture of your eye health and help your doctor decide on the best course of action. Whether it's monitoring disease progression or evaluating how well treatment is working, these maps are a valuable part of modern eye care. Always discuss your results with your eye specialist, who can explain what the findings mean for your specific situation and help you plan the next steps for your eye health.